We have some more unfortunate news coming out of the Supreme Court because, of course, we do. They are looking to further strip away your health care. This is courtesy of The Hill. It says reproductive rights groups fear SCOTUS ruling will inspire anti-abortion politicians. Let's go ahead and take a listen.
Reproductive rights groups fear SCOTUS ruling will inspire anti-abortion politicians. By Alejandra Ofconnell-Domnech, reproductive rights advocates are reeling from Thursday's Supreme Court ruling in favor of South Carolina in a legal case to block Medicaid funding for Planned Parenthood, which they fear will give other states the green light to do the same. Today's decision is a grave injustice that strikes at the very bedrock of American freedom and promises to send South Carolina deeper into a health care crisis, said Paige Johnson, president and CEO of Planned Parenthood South Atlantic. Twice, justices of this court denied to even hear this case because Governor McMaster's intent is clear. Weaponize anti-abortion sentiment to deprive communities with low incomes to basic health care. She continued.
We're going back in time. We're regressing as a society. The idea that reproductive health care should be any different from physical or mental health care is just fucking stupid. You are disproportionately impacting lower income people by stripping them away from abortion, access to birth control, to contraceptives, to all of the other resources that Planned Parenthood provides. Like, this is just cruel.
Mentioning Republican South Carolina Governor Henry McMaster. The case was not about abortion, but about whether Medicaid beneficiaries have the right to choose their preferred health provider and sue if they cannot. Under the law, anyone who receives health insurance through Medicaid can receive care from any qualified and willing provider. Public health funds do not typically pay for abortion care, but the ruling means that Medicaid patients in South Carolina will no longer be able to use their health insurance to pay for birth control, cancer screenings, sty testing and treatment, and other preventative health care offered at Planned Parenthood clinics. While the
Like,
ruling
do you know how fucking barbaric it is to live in a country like the United States of America? These very necessary and, again, proactive treatments, they're looking not to be covered by insurance. Like, do you think that someone just has like $1,500 lying around to go spend on a goddamn cancer screening? No. No, it's a further breakdown in an already fundamentally broken system that seeks to once again harm disproportionately marginalized communities.
only applies in South Carolina, reproductive rights groups believe elected officials in other states will use the case as a template to restrict healthcare access. Missouri, Arkansas, and Texas have already blocked Planned Parenthood from accepting Medicaid patients, and advocates expect other Republican-led states to follow suit.
Yeah, they're definitely going to do this. Yeah, absolutely. There were how many states? I think it was like a dozen that had trigger laws on Roe v. Wade. So as soon as Roe got overturned, abortion was outlawed. Republican-led states are going to do everything in their power to make sure that they further subject and oppress the female population. The fact that this is even a thing is sickening. Like, this is like third world country shit. Charlie Kirk is over here talking about, oh, what Muslim country would you like to live in, Jessica Tarkov? What about Missouri? Like, South Carolina? Hello? Of course, Charlie Kirk also hates women. So it's not surprising that he holds such a blatantly misogynistic view. Whenever it comes down to issues like this, to healthcare related issues, I cannot stress the fact that people are going to fucking die. People are going to fucking die directly because of these kinds of rulings.
As extremists in every branch of our government are targeting Planned Parenthood and attempting to strip millions of Americans of the care their health centers provide, this is nothing more than a politically motivated green light to anti-abortion politicians. Reproductive Freedom Caucus co-chairs Reps. Diana DeJette, Democrat from Colorado, and Ayanna Presley, Democrat from Massachusetts, said in a statement. The SCOTUS decision comes as Planned Parenthood faces losing federal funding in the Republicans' reconciliation bill. At least 200 Planned Parenthood clinics will be at risk of closing if the bill passes as is in the Senate, according to the organization. Anthony Wright, the executive director.
This is also indicative of, again, the Republicans' overall financial package. it's not only Planned Parenthoods that have been closing, but it's also hospitals in rural communities. So it's not hyperbolic to say that poor people in poor countries will just have no access to any kind of healthcare. And it, at least in regards to those clinics, it's federal funds that help keep them open. This is more specifically targeted under like the pro-life line of the party, but none of that fucking matters. If people need healthcare, they should be able to get healthcare. I don't think that, that should be a hot take. It doesn't matter if you live in fucking Massachusetts, New York, Missouri, or Arkansas. If you need preventative reproductive healthcare or even reactive reproductive healthcare, you should be able to just go and get it, with the only conversation being between you and your doctor. The government should not be involved. The Supreme Court should not be involved. This is just another issue that's on the table that shouldn't even be able to come to the table. Ideally, we would live in a world where the mere mention of this would be political suicide, and your constituents would stage a special election that day to get you the fuck out of office.
The consumer health advocacy group Families USA agreed that the move will likely serve as a green light for other states to try and impose similar restrictions. The court has now given a green light to states to impose even more harmful barriers to care, he said in a statement. This ruling will make it more difficult for people to access the care that they need, allowing politicians and courts to insert themselves into personal health care decisions. The Center for Reproductive Rights said in a statement it believes that the ruling opens the door for other Medicaid abuses by state officials who want to revoke funding to qualified clinics for other ideological reasons, like if they provide LGBTQ-specific healthcare or serve immigrant communities. They stress that the ruling will immediately impact low-income Americans. Roughly 72 million low-income Americans receive health insurance through Medicaid, according to the most recent enrollment numbers. And more than 1.3 million South Carolinians, or 20% of the state, are enrolled in the program, according to the health policy nonprofit KFF. Today's decision favors extremists who would rather let...
By the way, estimates say that anywhere from like 8 to 13 million Medicaid recipients will be kicked off of Medicaid if this big, beautiful bill passes, not just through reduced funding, but also through work requirements. There are, of course, also the chances of lapses due to the system being underfunded. I mean, like lapses in paperwork, filing, things of that nature. It's just so goddamn dark. Like, I don't know, dude. I'm going crazy.
Rather let someone die of cancer than let them get a cancer screening at a Planned Parenthood, said Nancy Northrup, president and CEO of the Center for Reproductive Rights. The Supreme Court overrode what the Medicaid law requires and every patient wants: the ability to choose their trusted healthcare provider. Northrup added that the ruling will put fuel on the fire on Republican lawmakers' multi-year effort to deny Medicaid patients access to non-abortion services at Planned Parenthood. Advocates highlighted that the ruling will also disproportionately impact communities of color in the state, and potentially across the country. Out of the roughly 72 million Americans on Medicaid, more than half are people of color, with Black and Hispanic Americans disproportionately enrolled in the program. Today's harmful decision from the Supreme Court is a direct attack Black women, girls, and gender-expansive people who rely on Planned Parenthood for life-saving healthcare services.
Also, children, another thing, not like the pro-life party is looking to make sure that children cannot get healthcare. How sick is that, dude? How fucking sick is that? I had fucking Joe Biden moment. I was gonna say something and I totally blanked. Oh well.
Said Regina Davis Moss, president, and In Our Own Voice, a reproductive rights nonprofit that highlights Black health experiences. This case was never about abortion, and now this ruling will have devastating consequences for the millions of Americans who will lose access.
Okay, I remember what I was gonna say. Since this is related to abortion, it is worth noting that this type of legislation and these type of actions are politically unpopular, overwhelmingly so. Whenever there is a down ballot measure on abortion, it doesn't matter if it's in New York or if it's in Kansas. 60% of people vote in order to preserve the right to an abortion. I believe it was like 65% in Kansas and 67% here in New York the last time that those measures were on the ballot, both of which were recently, I believe 2022 and 2024. Women want to be able to decide what to do with their bodies. It's not a revolutionary concept. Bodily autonomy is a massive, or the stripping of bodily autonomy is a massive invasion of privacy. Again, small government conservatism, by the way, telling you what you can and can't do with your body.
To reproductive health care. Moss added that Medicaid pays for almost 2/3 of births among Black mothers and ensures over half of Black girls in the U.S. Meanwhile, some anti-abortion groups lauded the SCOTUS decision, with the president of Susan B. Anthony Pro-Life America, Marjorie Dannenfelser, calling it a major step toward ending Planned Parenthood's taxpayer-funded gravy train. By rejecting Planned Parenthood's lawfare, the court not only saves countless unborn babies from a violent death and their mothers from dangerously shoddy care, it also protects Medicaid from exposure
That's
to thousands of
you are literally a stupid fucking person if you think that Planned Parenthood is giving out shoddy care. You get shoddy care when you don't have access to Planned Parenthood and you have to go into a fucking back alley clinic or a fucking speakeasy or a fucking Jiffy Lube to get your abortion. How fucking stupid do you have to be? Like, what are these goddamn mental gymnastics that these pro-life freaks engage in? Yeah, Planned Parenthood is actually putting mothers at risk. So we're going to further put them at risk by removing all of these Planned Parenthoods because, oh, by the way, like medical professionals work at Planned Parenthood, but the women are at risk. So we have to just send them out into the field and they can figure it out. They can figure it out. They think it'd be safer that way, some are saying.
From unqualified providers that would jeopardize the entire program, said Katie Daniel, Director of Legal Affairs at Susan B. Anthony Pro-Life America.
So obviously there is, this isn't happening right away, but I've always stressed foresight. I've done my best to stress foresight on this show, regardless of whatever the policy decision may be. It's not always about who is affected today. It's about who is affected tomorrow. It's about who is affected next year or who's affected 2 years from now. This is one of those decisions that will have tremendous ramifications if it is not appropriately fought back against. This is yet again another attempt at government overreach and a suppression of the healthcare system for what is all healthcare is important. Reproductive healthcare is no different.